Welcome to Module 2 of the e-learning course on estimating maternal mortality from census data. In this module, we will discuss census questionnaire design, training, and tabulation. The goal of this module are to know the recommended mortality and fertility questions needed to measure pregnancy-related and maternal mortality from census data. Understand best practices for questionnaire design when including pregnancy-related mortality questions. Identify common errors in census mortality and fertility data and how to avoid them. Understand what tabulations are required to estimate pregnancy-related and maternal mortality from census data. This module is organized into 3 episodes. In Episode 1, we will discuss census questions for pregnancy-related and maternal mortality estimation. In Episode 2, we will cover common data collection problems for pregnancy-related and maternal mortality indicators and how to avoid them. In Episode 3, we'll go over required tabulations for estimating pregnancy-related and maternal mortality. Episode 1, Census Questions for Pregnancy-Related and Maternal Mortality Estimation. So why ask about pregnancy-related or maternal death in a census? A big advantage of asking about pregnancy-related or maternal death in a census is that it requires minimal addition to the core topic questions recommended in the United Nations Principles and Recommendations for Population and Housing Censuses. The UN recommends that questions on recent household deaths be asked in countries lacking complete civil registration and vital statistics systems. To obtain pregnancy-related mortality measures requires adding only 3 follow-up questions for deceased women of reproductive ages. To obtain maternal mortality measures requires adding just 4 questions. Therefore, a country can obtain these measures with relatively small additional effort. Another advantage of a census is that there is no sampling, and we can obtain large numbers. For relatively rare events like maternal deaths, this is a big advantage. Doing a survey to capture maternal deaths can be costly since you would have to visit a large sample of households to find those that experienced maternal deaths. In addition, census data using recent household deaths allow us to calculate maternal mortality ratio directly using the formulas covered in Module 1. This is in contrast to many surveys where the MMR is calculated indirectly using questions about deaths of a sibling. Further, we can produce estimates at the subnational level with the census. And finally, censuses can be followed with a post-enumeration verbal autopsy survey in order to obtain detailed cause of death. Now that we have talked about the many advantages of using the census to obtain pregnancy-related and maternal death indicators, let's look at the questions that need to be asked in order to produce the indicators. Here are the recommended census questions on pregnancy-related and maternal mortality. The first set of questions are general questions on recent household deaths. The first question asks if any usual member of the household died within the last 12 months. Notice that we ask about the death in the last 12 months instead of the last year. We recommend that you avoid the use of years. Wording like in the last year can be interpreted as the last calendar year instead of the last 12 months. So to make sure that the respondent understands exactly what you're asking, it's best to ask about the last 12 months. Length of the recall period is generally 12 months, but it can be changed to anchor it to a well-known day, for example, the Lunar New Year. Including the dates of the recall period in the question may improve the data quality. For example, you can say since August 1st, 2020. For small populations, the recall period can also be extended to 24 months. If using a 24-month recall period, a question on the second most recent birth should be added to the fertility section. We'll cover this some more when we talk about the fertility question. If the respondent answers yes to this question, then you would proceed to ask about each deceased person. The first question when asking about the deceased person is asking the name of the person. Asking names of the deceased generally improves recall. Then ask the sex of the deceased person, then the age at death. Be sure to record the completed years of age. If the respondent says the deceased was almost 15, record 14. Age at death can be replaced with the date of birth and date of death, if dates are well known and well reported in a population. Asking about the month and year of death is useful, since it can be used to verify that the death occurred during the recall period. The next question is whether the death was due to an accident, violence, homicide, or suicide. Answers to this question will be used to differentiate between pregnancy-related and maternal deaths. If asked for all deceased, this question can also give an overall indicator of the proportion of deaths due to external causes. Then finally, we ask a set of 3 questions if the deceased was female, aged 15 to 49. We ask at the time of death, was she pregnant, giving birth, within 6 weeks of the end of a pregnancy or childbirth? These 3 questions identify the timing of death relative to pregnancy for women who die during their reproductive ages. We recommend that you ask these 3 questions separately rather than combining the questions to one. When you combine the question becomes too long and confusing. The respondent may answer no before the enumerator has had the chance to ask the full question. It doesn't take much longer to ask the question separately, so to get the most accurate answer, it's best to ask the 3 questions separately. In populations where childbearing begins at younger ages, these questions may be asked of females who died between ages 12 to 49 instead of ages 15 to 49. Notice that we ask about death within 6 weeks of the end of pregnancy or childbirth. The ICD-11 defines postpartum period as 42 days, but 6 weeks can be used for simplicity. Here are some additional best practices for census mortality questionnaire design. First, let's talk about the do's. Do ask the 3 pregnancy-related questions separately to identify the timing of death of a woman in her reproductive ages. Do keep the household death questions in a self-contained box in a prominent position of the census questionnaire. Now, let's talk about the don'ts. Don't use a separate sheet for the death questions. It is not uncommon for the mortality section of the census questionnaire to be skipped by the census taker. Having the death questions in a prominent positions on the same sheet makes it harder for the census taker to miss the questions. Don't ask if the death was due to pregnancy-related or maternal causes. This will not capture all pregnancy-related or maternal death. Why is that? Because as we discussed in Module 1, pregnancy-related deaths are defined by the timing of death relative to pregnancy, not the cause. So if you ask if the deceased died of a pregnancy-related cause, it would capture only a portion of the pregnancy-related deaths, those that result from obstetric causes or direct maternal deaths. But pregnancy-related death has a broader definition. Therefore, it's important to ask the recommended 3 questions on the timing of death relative to pregnancy. Similarly, maternal deaths are pregnancy-related death, excluding those deaths due to accidental or incidental causes. Asking whether the deceased died of maternal causes would only capture direct maternal death and leave out the indirect maternal deaths. Also, don't ask for the complete cause of death information in the census questionnaire. Rather, it is better to conduct a follow-up verbal autopsy survey for a sample of household deaths. This is because asking respondents about the cause of death usually do not result in quality data. You can find the questionnaire design recommendations we just discussed and more in the brief on measuring maternal mortality on our website at the link here. Now it's time for a knowledge check. Let's look at some examples of questions on pregnancy-related and maternal mortality. Take a look at the question below. Does this question capture pregnancy-related deaths? If you said no, you are correct. This question does not capture pregnancy-related deaths. Why? The question asks what was the cause of death. In the response option under illness, options 9 and 10 are pregnancy complication and delivery complication. But as we discussed earlier, pregnancy-related death is defined as the death of a woman while pregnant or within 42 days of termination of pregnancy. Although the response categories under illness include pregnancy complication and delivery complication, the question doesn't ask about the timing of death relative to pregnancy. If a woman dies of a cause not directly related to pregnancy or delivery complication, but while pregnant or within 42 days of termination of a pregnancy, her death should still be counted as a pregnancy-related death. However, with this question, we don't know when she died relative to pregnancy. So this question does not capture pregnancy-related death. How about maternal deaths? Does this question capture maternal deaths? If you said no, you are correct. As you recall, the definition of maternal death is the death of a woman while pregnant or within 42 days of termination of pregnancy irrespective of the duration and the site of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from incidental or accidental causes. So maternal deaths are a subset of pregnancy-related deaths. So since pregnancy-related deaths are not captured here, neither are maternal deaths. You may be saying, but pregnancy complication and delivery complication are listed as causes, so we should be able to capture maternal deaths. But remember, these two choices would capture direct maternal deaths, not indirect deaths. So no, this question does not capture maternal deaths. Let's look at another question. Does this question capture pregnancy-related deaths or maternal deaths? The answer is both yes and no. This question captures pregnancy-related deaths, but this is not the recommended way to ask the questions. Asking the question this way may be prone to error. It is better to ask the question as 3 separate questions to obtain a more complete answer. The question does not capture maternal deaths. Why? Because it does not ask about accidental or incidental deaths. Maternal deaths do not include accidental or incidental deaths, and this question alone does not allow us to remove those who died from accidental or incidental deaths from pregnancy-related deaths. So, you will not be able to estimate maternal mortality from this question. Only pregnancy-related deaths. Do these questions capture pregnancy-related deaths or maternal deaths? The answer is no, neither. These questions do not ask the deceased woman's age. Another important thing to notice about the way these questions are asked is that the pregnancy-related death questions in D3 are asked only of those who died of pregnancy-related cause in D2. Remember, pregnancy-related deaths as defined by the WHO are irrespective of cause. Therefore, all women who died in their reproductive years need to be asked the pregnancy-related death questions. Even if the woman died as a result of a motor accident, if she was pregnant at the time, her death should be considered a pregnancy-related death. When you only ask the pregnancy-related death questions to those who died of pregnancy-related causes, you will underestimate the number of pregnancy-related deaths. Since pregnancy-related deaths are not fully captured here, maternal deaths are also not captured. Do these questions capture pregnancy-related deaths or maternal deaths? Yes, these questions capture both pregnancy-related deaths and maternal deaths. The questions ask for sex, age at death, and the questions in the square box capture pregnancy-related deaths. The addition of the question regarding accident, injury, suicide, or violence allows you to exclude those deaths from pregnancy-related deaths, and thus allows you to estimate maternal deaths. Do these questions capture pregnancy-related deaths or maternal deaths? Yes, these questions capture both pregnancy-related and maternal deaths. The questions ask for the sex and age at death of the deceased. These questions here capture whether the woman's death was pregnancy-related. The addition of the question regarding accident and injury, suicide, or violence allows you to exclude those deaths from pregnancy-related deaths, so you can estimate maternal deaths. Now let's move to the questions about fertility. As we discussed in Module 1, in addition to the mortality questions, we need fertility questions to calculate the pregnancy-related and maternal mortality ratios. The UN recommends that we ask 2 sets of questions related to fertility. The first set of questions are on children ever born and children surviving. They measure lifetime fertility. The second set of questions ask about recent fertility by asking about the last child born alive. Let's first talk about the questions on children ever born and children surviving. These questions ask each woman aged 15 and over, regardless of their marital status, their total number of sons ever born alive during the lifetime of the woman, total number of sons living or surviving at the time of the census, total number of sons born alive who have died before the census date, total number of daughters ever born alive during the lifetime of the woman, total number of daughters living or surviving at the time of the census, and total number of daughters born alive who have died before the census date. These 6 questions were designed to fully account for all children ever born. Asking about sons and daughters separately improves the accuracy of the data and allows for calculation of fertility measures by sex. While only responses to questions about sons or daughters ever born alive, questions 1 and 4, are used to estimate fertility, the other questions serve as checks. Census takers can add the number of children living and dead to compare against the total number of children ever born alive. They can then resolve any discrepancies at the time of the interview. While there may be sensitivities to asking questions about fertility to never married women, the UN recommends that effort should be made to collect this information regardless of marital status. Doing so will improve the accuracy of the data. If it is not possible to ask the questions of all women, then at least ask of all women who are or have ever been married or in a union, including widowed, divorced, or separated women. The number of children ever born alive should include all children who were born alive to a woman during her entire lifetime, up to the census date. Sometimes the census takers arrive at the household a few days after the census date. If the child was born after the census date, but before the census taker's arrival, do not include them. For example, if the census date is on August 1st, the child was born on August 2nd, and the census takers arrived at the household to ask the questions on August 3rd, do not include the child born on August 2nd after the census date. At the same time, it is important to include any child who showed any sign of life at birth, even for a very short time. These include any child who was alive or dead at the time of the census, regardless of whether the child was born in or out of marriage, or in the present or prior marriage, and regardless of whether the child currently lives with the mother, the age of the child, or the marital status of the child. Do not include stillbirths or other fetal deaths, adopted children, or stepchildren. This is because we are trying to count the number of live births. In the case of multiple births, like twins, each child should be counted as a separate birth. The UN recommends asking about the date of birth, day, month, and year, and sex of the last child born alive to women 15 to 49 years, regardless of marital status, as an addition to the children ever born alive questions. The date of birth of the last child born alive can be used to obtain current fertility at national and subnational levels. This question is preferred over asking about the number of births within the last 12 months. Asking about the date of birth of last child born alive is considered more accurate than asking about birth in the last 12 months because of errors and omissions in the reporting of live birth within a 12-month time period. In cases where a woman has had more than one birth in a 12-month period, using date of birth of the last child born alive to calculate birth within the last 12 months could lead to underreporting of births. But these cases are rare and do not affect the fertility estimates much. You can find more about these questions in the brief on measuring fertility from a census on our website at the link here. To conclude this episode, asking the right questions is the first step to collecting census data on pregnancy-related and maternal deaths. Without having asked the necessary questions, you cannot estimate pregnancy-related or maternal mortality correctly. Census-based estimates are usually pregnancy-related mortality unless accidental and incidental deaths have been excluded from the estimates during the tabulation stage. Census-based estimates are a relatively cost-effective way to obtain both national and subnational estimates because only a few questions needed to be added to the core topic questions from the UN Principles and Recommendations for Population and Housing Censuses. However, they are subject to biases and misreporting, just like when using other data sources. For example, we discussed that the census questions asking about the date of last child born alive only records one birth from multiple births, like a set of twins, and therefore can lead to an undercount of birth in the last 12 months. Also, census estimates often miss deaths in the single-family households or households that broke up after the death of the mother. This is because the death questions are asked at the household level about deaths to usual household members. No one may be around to report a death in a single-person household or in households that dissolved after the death of the mother. Census data on household deaths are also subject to other sources of misreporting. In the next episode, we will go over some common sources of errors during data collection and how to avoid them. These are all reasons why we need to evaluate census data carefully when estimating pregnancy-related and maternal mortality. We will discuss how to do that in detail in modules 3 through 5 of this course. To conclude this episode, asking the right questions is the first step to collecting census data on pregnancy-related and maternal deaths. Without having asked the necessary questions, you cannot estimate pregnancy-related or maternal mortality correctly. Census-based estimates are usually pregnancy-related mortality unless accidental and incidental deaths have been excluded from the estimates during the tabulation stage. Census-based estimates are a relatively cost-effective way to obtain both national and subnational estimates because only a few questions need to be added to the core topic questions from the UN Principles and Recommendations for Population and Housing Censuses. However, they are subject to biases and misreporting, just like when using other data sources. In the next episode, we will go over some common sources of errors during data collection and how to avoid them. These are all reasons why we need to evaluate census data carefully when estimating pregnancy-related and maternal mortality. We will discuss how to do that in detail in modules 3 through 5 of this course.